I might die in 7 hours and I'm not afraid. I'm 19, and I donated bone marrow to my little sister when I was 16. The doctors said I was a perfect match. She beat leukemia because of me. Last week she called me crying. Her cancer came back. Stage 4. The transplant I gave her 3 years ago failed. But here's the thing. Nobody knows. When they tested me again, I'm still a perfect match. Same as before. The doctor said we could try one more transplant, but my body's weaker now. I had complications last time that never fully healed. My hip never stopped aching after the first donation. Sometimes I wake up at 3 a.m. and can't move my left leg for 20 minutes. The doctor said it's nerve damage from the extraction. Permanent. They gave me the statistics for a second donation. 35% chance of severe complications. 15% chance I don't wake up. 8% chance of paralysis if something goes wrong with the spinal procedure. My parents begged me not to do it. My girlfriend threatened to leave if I went through with it. They said I already gave her a chance once and that should be enough. I broke up with her yesterday. She screamed at me in the parking lot of the hospital, called me selfish, said I was choosing my sister over our future together, over the life we planned over her. I just stood there and let her yell. What was I supposed to say? That she's right? That wanting to save my 4-year-old sister makes me selfish? My dad pulled me aside 2 days ago. He had this look on his face I'd never seen before. He said, "Son, you already gave her 3 extra years. You don't owe anyone your life." But he's wrong. I remember the day I donated the first time. I was 16, terrified, lying on that cold table. The anesthesiologist told me to count backwards from 10. I made it to 7 before everything went black. When I woke up, my sister was in remission. The pain in my hip was worth it. Every single second of it. She got to go to her 8th grade dance. She got to try out for the school play. She got to have 3 more years of being a normal kid instead of a patient. Now she's 14. She's supposed to go to prom next year. She's supposed to graduate high school. She's supposed to live. I've lived 19 years. That's 5 more than her. My mom hasn't spoken to me in 48 hours. She locked herself in her bedroom when I told her I was going through with it. I heard her crying through the door, but she wouldn't let me in. My dad just keeps staring at me like he's trying to memorize my face. The surgery is scheduled for 6 a.m. It's 11 p.m. right now. I'm sitting in the pre-op room at Johns Hopkins typing this on my phone. The room smells like disinfectant, and the fluorescent lights are giving me a headache. My sister doesn't know I'm doing this. My parents think I backed out after our fight. I told the hospital to call them after I'm under. I left them a note in my apartment explaining everything. They'll find it after. The nurse just came in to check my vitals. She asked if I was nervous. I said no. She smiled like she didn't believe me. My hands aren't shaking. My heart rate is 64 beats per minute, normal. I keep thinking about this memory from when my sister was 6. We were at the beach and she was terrified of the waves. I held her hand and walked her into the water. She was screaming and laughing at the same time. She held my hand so tight it hurt. That's what I keep thinking about. Her hand in mine, how tight she held on. The doctor came in an hour ago with the consent forms. He went through every risk again, made sure I understood, asked if I wanted to reconsider. I signed without reading them. He looked at me for a long time. Then he said, "You're very brave." I'm not brave. Brave would be doing this scared. I'm doing this certain. If I die, she lives. If I don't, we both do. I've got 6 hours and 52 minutes left. The anesthesiologist will come in at 5:30 a.m. to prep me. At 6 a.m., they'll wheel me into the operating room. The surgeon said the procedure takes 4 hours. By 10 a.m., either I'm in recovery or I'm gone. The surgeon made the first incision at 6:14 a.m. I was already under, couldn't hear him calling for additional imaging, couldn't hear the confusion in his voice. I woke up at 9 a.m. in a different recovery room with the surgeon standing over me. "We couldn't complete the donation," he said. "When we went in, we found something. You have the same cancer as your sister. The worst part is they'd already started prepping her for the transplant, because in 20 minutes they're going to have to tell a 4-year-old girl that her brother can't save her anymore." The surgeon, Dr. Patel, pulled up a chair. His face was completely drained of color, like he'd aged 10 years in the 4 hours I was under. "During the pre-extraction imaging, we found abnormal cells in your bone marrow," he said, his voice steady but quiet. "They match your sister's leukemia markers exactly. Same aggressive form, same mutation pattern." I just stared at him. My mouth was dry from the anesthesia. I tried to sit up, but my body felt like it weighed 1,000 pounds. "That's not possible," I said. "You tested me 3 weeks ago. You said I was fine." He rubbed his face with both hands. "The cancer is developing rapidly. It likely wasn't detectable 3 weeks ago, or it was so minimal it didn't show up. But based on what we're seeing now, we believe the complications you experienced from your first donation 3 years ago may have triggered dormant cancer cells. So I gave myself cancer by trying to save my sister. We don't know that for certain, but it's a possibility we have to consider." The room started spinning. Not from the drugs, from the realization that I destroyed 2 lives trying to save 1. My parents arrived within the hour. I heard my mom before I saw her, this guttural scream echoing down the hallway. Then she was in my room, collapsing against the wall, sliding down to the floor. My dad just stood there, frozen by the doorway. He wouldn't look at me. His eyes were locked on some point above my head, like if he actually looked at my face, he'd shatter completely. A nurse helped my mom into a chair. She kept saying no over and over, like she could refuse reality if she just said it enough times. Dr. Patel repeated everything. The abnormal cells, the matching markers, the rapid development. My mom's face went from shock to anger, to this horrible blank expression that scared me more than anything. "Tell Maya," she finally said. Her voice sounded mechanical. "Tell our daughter, Mrs. Hart. Perhaps we should wait." "Tell her now," my dad said, first words he'd spoken since arriving. "She deserves to know." So they decided to tell my sister about both diagnoses simultaneously. A nurse took her to a private consultation room while I was still stuck in recovery. I wanted to be there, but they wouldn't let me get up yet. I found out later that when the oncologist, Dr. Chen, explained that neither of us could save the other now, Maya refused to believe it. "Test him again," she'd screamed, according to the nurse who was there. "You're lying. You just don't want to do the transplant because you're scared." She became hysterical, tried to rip out her IV. Security had to hold her back when she attempted to leave the hospital, saying she'd find another facility that would do it, that she'd find someone who wasn't incompetent. By the time I was finally allowed to see her 3 hours later, she was sedated. Her room was 3 doors down from mine. I made them wheel me there in a chair because I couldn't walk yet from the anesthesia. She looked so small in that bed. Her head was already bald from her previous treatments. There were new bruises on her arms from where security had to restrain her. "Hey," I said softly. Her eyes opened. For a second I saw hope flicker there, like maybe this was all a nightmare and I was about to tell her everything was fine. Then she remembered. The hope died. "I'm sorry," I said. My voice cracked. "Don't." She turned her face away. "Just don't." They moved me to the oncology wing that same afternoon. Same floor as Maya, just different hallway. They immediately started running comprehensive tests. CT scans, PET scans, blood work every 2 hours. The preliminary results came back while my dad was sitting with me, still not talking, just staring at his hands. The resident came in with a tablet. "The cancer is already at stage 3, she said. "The cell multiplication rate is extremely aggressive. We need to start treatment immediately." "How immediately?" my dad asked. "Tomorrow, maybe tonight if we can get the protocol approved." Stage 3. I'd gone from healthy to stage 3 in less than a month, possibly less than 3 weeks. My ex-girlfriend, Jennifer, showed up 2 days later. Someone from our friend group must have told her. She found me in the common area, trying to walk without looking like I was about to pass out. The hip pain from the aborted donation was worse than the first time. "Oh my God," she said when she saw me. Her eyes were already red. "I'm so sorry. I'm so fucking sorry for what I said." "It's fine. It's not fine." She was crying now, full sobs. "I called you selfish, and you were just trying to save your sister, and now you're both. Jennifer, you need to leave. Please, let me just—" "I can't handle your guilt right now," I said, probably harsher than I needed to. "I have my own shit to deal with. You don't get to make this about you feeling bad." She stood there for another moment, mouth open like she wanted to argue. Then she turned and left. I haven't seen her since. The oncologist, Dr. Chen, the same one who told Maya, presented treatment options during a family meeting 4 days after my diagnosis. Both my parents were there. Maya was wheeled in on a hospital bed because she was too weak to sit in a wheelchair. "Here's what we're looking at," Dr. Chen said, pulling up scans on the monitor. "You both have the same origin cancer, but it's mutated differently in each of you. Maya's is more aggressive in terms of growth rate and has spread to her brain. Your cancer has spread to your lymph nodes and is showing early signs in your lungs." He clicked through images that meant nothing to me, just blobs and shadows. "We'll need different chemotherapy protocols for each of you. Similar drugs, different dosages and combinations. We're also going to recommend radiation for Maya's brain tumors." My mom hadn't eaten in days. I'd noticed but hadn't said anything. Now I watched her sit there, hands folded in her lap, completely still. She didn't ask questions, didn't nod, just stared at the wall behind Dr. Chen's head. My dad took notes, wrote down every word. His handwriting was shaking so badly I could see it from across the table. They started our chemotherapy the same week. Maya was 3 doors down from my room. We were on the same schedule, same days. I could hear her getting sick through the walls on the nights when the medication hit hardest, around 2 a.m. The first time it happened, I tried to get up to go to her, but a nurse stopped me. "She has her own team," the nurse said kindly. "You need to rest." But how was I supposed to rest knowing my little sister was puking her guts out alone? The hip pain from the original donation intensified with the cancer treatment. Something about the chemo aggravated the nerve damage. It got to the point where I couldn't walk without assistance. Nurses brought me a wheelchair that I refused to use for the first week. "I'm not sitting in that thing," I told my dad when he suggested it. "I'm 19, not 90. Your pride is going to make you fall and crack your head open," he said. He wasn't wasn't wrong. I'd already stumbled twice. But I didn't use the chair until I actually did fall, right outside Maya's room, face planted into the linoleum floor. Split my lip open. After that, yeah, I used the damn wheelchair. A hospital social worker named Patricia tried to counsel our family about preparing for worst-case scenarios. We were all in a conference room. Patricia had pamphlets about hospice care and advanced directives and grief counseling. My dad stood up in the middle of her sentence and walked out. Didn't say a word, just left. My mom threw a clipboard at the wall. "Both my children will survive this," she screamed. "Do you hear me? Both of them." Patricia just nodded and said she'd give us some time. She never brought it up again. Maya snuck into my room one night after the nurse's rounds. It was probably around midnight. She climbed into my hospital bed without saying anything, just pressed herself against my side like she used to do when she was little and had nightmares. I pulled out my phone and we watched old videos from when we were kids. Videos at the beach, at her 8th grade dance, at her school play. The play where she'd gotten the lead role, Dorothy in The Wizard of Oz, 3 months after my first donation. I'd saved all these videos to my cloud storage last month, just in case. I didn't tell her that. "Remember when you walked me into the ocean?" she said during one video. "You held my hand so tight I thought you'd break my fingers. I was terrified." "I know, but you did it anyway." She was quiet for a while. Then she said, "I'm terrified now too." "I know. Are you?" I wanted to lie, tell her I wasn't scared at all, but she'd see through it. "Yeah," I admitted. "I am." She squeezed my hand. 3 times. Our old signal, "I love you." I squeezed back 3 times. The first round of chemotherapy failed to stop my cancer's progression. My white blood cell count dropped to dangerous levels and I developed a severe infection that put me in isolation for 6 days. They sealed off my room with plastic sheeting, and everyone who came in had to wear full protective gear. I couldn't see anyone except nurses and doctors, not even my parents. They'd stand outside the plastic barrier and wave. My mom cried every time. My dad just stood there with his hands in his pockets. During those 6 days, I found out Maya's condition had stabilized slightly. Her latest scans showed the tumors had stopped growing, not shrinking but not getting worse either. "That's good, right?" I asked Dr. Chen through the plastic barrier. He was checking my vitals, which was complicated with all the protective equipment. "It's a temporary response," he said carefully. "Her body is adjusting to the treatment, but the cancer will adapt. It's what it does. How long? Could be weeks, could be months. We'll know more at the next scan." On the 7th day, they cleared my infection enough to remove the isolation. I immediately asked to see Maya. They wheeled me down to her room. She'd lost more weight. Her cheekbones were sharp and her eyes looked huge in her face. "You look like shit," she said when she saw me. "Back at you." We both tried to laugh, but it came out weak. A nurse took our photo with my phone. Both of us bald, both of us in hospital gowns, both of us smiling like idiots even though we probably shouldn't have been. My mom framed that photo, put it on the table between our rooms, but she can't look at it without starting to cry, so she usually keeps it turned face down. My hair fell out completely within 3 weeks of starting chemo. Just came out in clumps every time I touched it. One morning I woke up and there was hair all over my pillow, like someone had shaved me in my sleep. Maya shaved her head in solidarity even though her hair was already mostly gone and thin. She came into my room with a buzzer and said, "We're doing this together." She buzzed what was left of her hair right there, standing over my bed. Then she climbed up next to me and we took a selfie, both completely bald, both trying to smile. I sent the photo to my phone, saved it, just in case. My mom's sister, Aunt Diane, visited a few weeks into treatment. She brought these expensive herbal supplements in fancy packaging. "I've been reading about alternative treatments," she said, setting bottles down on the table between our beds. Maya was asleep in her room, but my parents were both there. "These are supposed to boost the immune system and target cancer cells naturally." My dad picked up one of the bottles, read the label, then walked over to the trash can and dropped it in. "Hey," Aunt Diane said. "Get out," my dad said calmly. "Excuse me? These kids are getting real medicine from real doctors. They don't need your internet conspiracy bullshit. I'm just trying to help. You're not helping. You're making my wife feel like we're not doing enough when we're doing everything possible." Aunt Diane looked at my mom for backup. My mom just stared at her hands. "Well," Aunt Diane said, gathering her purse, "I can see I'm not wanted here." "Yeah, you figured that out," my dad said. "Don't come back unless you're going to actually support us." At the door, Aunt Diane turned back. "You know, this is karmic punishment for something. Maybe you should think about what you did to deserve this." My dad took a step toward her and she left. Fast. Nobody mentioned it again, but Aunt Diane was permanently banned from visiting. Maya started having seizures about a month into treatment. The first one happened while a nurse was checking her vitals. I heard the commotion from my room, heard the code being called over the intercom. I wheeled myself as fast as I could to her room. They wouldn't let me in. Security actually had to hold me back while doctors worked on her inside. She was unconscious for 20 minutes. When she came to, she didn't remember the seizure at all, just woke up confused with a bunch of people surrounding her bed. The doctors added anti-seizure medication to her treatment plan. Dr. Chen pulled my parents aside. I wasn't supposed to hear this conversation, but I was right outside the door. The seizures indicate the cancer has spread further into her brain than we initially thought, Dr. Chen said. Her condition is deteriorating faster than we expected. My mom made a sound like she'd been punched. What does that mean for her prognosis? My dad asked. I can't give you a timeline, but we need to be realistic about what we're facing here. I wheeled back to my room before they saw me listening. Sat there in the dark for hours. I overheard my parents arguing in the hospital cafeteria a few days later. I'd gone down to get juice, and they were sitting at a table in the corner. They didn't see me. We can't afford both of them, my mom said. Her voice was flat. Dead. Don't say that. It's true. The insurance is covering most of it, but the co-pays for 2 full cancer treatments, the experimental drugs, it's draining everything. We're going to lose the house. Then we lose the house. And then what? We treat them both and end up homeless? Or we focus on one and give them the best possible chance? Jesus Christ. You want me to choose between our kids? She's younger. She has her whole life ahead of her. He's our son. I know who he is. My mom was crying now. Don't you think I know? But we have to be practical. We have to make decisions that give someone the best chance. My dad stood up, his chair scraped across the floor. I'm not having this conversation. We treat them both. I'll take out a second mortgage. I'll sell everything we own. But we're not choosing. He walked away. My mom put her head in her hands. I wheeled back to my room without getting the juice. Didn't tell anyone what I'd heard. The hospital financial counselor, a woman named Gloria, met with my parents the following week to discuss payment options. She laid out everything in a folder. The costs so far, the projected costs for continued treatment, the insurance coverage, and the gaps. My parents sat there looking at numbers that meant bankruptcy. There are payment plans available, Gloria said gently, and we can help you apply for additional financial assistance programs. Some pharmaceutical companies offer help with drug costs. We'll figure it out, my dad said. That weekend, I found out they'd taken out a second mortgage on the house. Not from them, from my uncle who called my dad yelling about how irresponsible it was. I heard my dad's side of the conversation through the hospital room wall. What else am I supposed to do? Let them die? You have a better idea. I'm all ears. No? Then shut the fuck up about my financial decisions. He hung up. I heard something crash. Maybe he'd thrown his phone. My childhood best friend, Tyler, visited about 6 weeks into treatment. He brought my old hockey jersey from high school, the one I'd worn when we won regionals junior year. Thought you might want this, he said, setting it on my bed. We talked for a while. Normal things. About the team, about this girl he was dating, about the new season starting soon. Then, he just broke, started crying right there in his chair. I'm sorry, man, he said, wiping his face with his sleeve. I don't know what to say. I'm terrified of watching you die, and I don't know how to be here for you. You're here, I said. That's enough. Is it, though? Because I feel like I should have better words or something. Like there's something I should be doing to help and I'm just failing. There's nothing anyone can do. You're being a good friend just by showing up. He stayed for another hour. When he left, he hugged me, really hugged me, like he was trying to memorize what it felt like. Maya's oncologist came to us with news about a clinical trial. Dr. Chen had a tablet pulled up with information. There's an experimental immunotherapy showing promise in pediatric cases, he said. It's currently in phase 2 trials, specifically for the type of aggressive leukemia Maya has. What's the catch? My dad asked immediately. There's only one spot available in the trial. 3 other patients in this hospital qualify for it. My mom sat up straighter. What do we need to do? There's a selection committee. They'll interview all qualifying patients and their families. They look at various factors like disease progression, overall health, quality of life, metrics, and likelihood of positive response. When? My mom asked. Tomorrow afternoon. The next day, the clinical trial selection committee interviewed all 4 qualifying patients. I watched via video call from my room. Couldn't physically be there because I was too weak, but they set up a laptop so I could see Maya make her case. She sat in a chair that looked too big for her, wearing her favorite hoodie. The committee was 5 people in suits, all looking serious and tired. Why should you be selected for this trial? One of them asked. Maya took a breath. I'm 14 years old. I've spent almost a quarter of my life fighting this disease. My brother donated bone marrow to me when I was 11, and it gave me 3 extra years of being normal. 3 years of going to school, doing plays, having friends. 3 years of just being a kid. She paused. Her voice was shaking but steady. I want to go to high school. I want to go to prom. I want to graduate and go to college and figure out what I want to do with my life. I want to fall in love and get my heart broken and travel and do all the things people are supposed to do when they have a whole life ahead of them. I know I'm not the only person who wants those things, but I'm asking you to give me the chance to have them. I saw one of the committee members wipe their eyes. The other families made their cases too. A 12-year-old boy with 2 little sisters. a 16-year-old girl who was supposed to start college next year, a 13-year-old kid who played violin and dreamed of being in an orchestra. Any of them could have been chosen. All of them deserved it. 2 days later, Dr. Chen came to Maya's room with the results. My parents were there. I wheeled myself over even though I was supposed to be resting. "The committee has made their decision," Dr. Chen said. He looked at Maya. "You've been selected for the trial." My mom burst into tears. Happy tears this time. My dad pulled Maya into a hug so tight I thought he'd break her. I felt relief flood through me, and guilt, because somewhere in this hospital, 3 other families just got devastating news. Maya started the immunotherapy trial 2 days later. They administered it through an IV over several hours. She had to be monitored constantly for adverse reactions. The first week, nothing dramatic happened. She felt tired, nauseous, the usual side effects, but her energy didn't get worse like it had been. The second week, something shifted. She ate an entire meal without getting sick. That hadn't happened in months. By the third week, her appetite was improving. She asked for specific foods instead of just picking at whatever was put in front of her. The doctors warned it was too early to call it a success. Cautious optimism, they said, but you could see the hope starting to creep back into my parents' faces. Meanwhile, my own treatment switched to a more aggressive protocol. The regular chemo wasn't working fast enough, and the cancer was spreading. They put me on a combination that made me violently ill almost immediately. I lost 30 pounds in a month, couldn't keep water down most days. Everything tasted like metal or chemicals. The inside of my mouth was covered in sores that made eating torture. Maya would sneak popsicles from the pediatric ward when nurses weren't looking. She'd bring them to my room and we'd sit there sucking on them in silence. Sometimes that was all I could keep down. My dad had always been the strong one, the one who held everything together. But one night, probably around 2 a.m., he came into my room and just broke down. I was half asleep when I heard him crying. Quiet at first, then these deep, shuddering sobs. "Dad?" He was sitting in the chair next to my bed, head in his hands. "I don't know how to be strong for both of you anymore," he said through tears. "I don't know how to watch this and keep pretending it's going to be okay. I don't know how to go home to that empty house and sleep in my bed knowing you're both here suffering." I reached out and took his hand. Didn't say anything. What could I say? "I've been sleeping in my car," he admitted. "In the parking lot. I can't face going home. It's too quiet, too empty. Dad, I'm supposed to protect you, both of you. That's my job. And I can't do anything. I can't fix this. I can't make it better. I just have to watch and it's killing me." We sat like that for a long time. Him crying, me holding his hand, both of us broken in different ways. A doctor I'd never met before came to my room one afternoon when I was alone. Dr. Rodriguez, according to his name tag. He had papers in his hand. "I need to discuss your advance directive," he said, sitting down. "My what?" "If your heart stops. Do you want us to resuscitate you?" It's a standard question for patients in your condition. I was 20 years old, and having to decide whether I wanted doctors to bring me back if I died. "What happens if you don't?" I asked. "You'd be DNR. Do not resuscitate. We'd keep you comfortable, but we wouldn't perform CPR or use defibrillation. And if you do, there are risks. Broken ribs, potential brain damage if there's oxygen deprivation. The success rate in cancer patients is significantly lower than the general population." I thought about it. Really thought about it. "Do everything," I said finally. "If my heart stops, bring me back. Whatever it takes." He made notes on the papers. "Are you sure? Some patients prefer." "I'm sure. My sister's still fighting. I'm not giving up while she's still here." He nodded and left. I sat there for a long time after, thinking about the fact that I'd just made decisions about my own possible death. Maya's trial continued showing improvement. Her latest scans, about 3 weeks in, showed the tumors in her brain were shrinking, actually shrinking. "This is remarkable," Dr. Chen said, pulling up the images. "We're seeing a significant reduction in tumor size and the rate of growth has completely stopped." My parents cried. The good kind of crying. Maya was moved out of critical care into a regular oncology room. Still on the same floor as me, just a different wing. A room with windows instead of those small ones near the ceiling. Actual sunlight. I wheeled myself over to see her new room. She was sitting up in bed, watching TV, looking more alive than she had in weeks. "Check it out," she said, pointing to the window. "I can actually see outside. There's a tree and everything. Living in luxury now." I know, right? Next thing you know, they'll give me room service. We both laughed. It felt good to laugh. But while Maya was improving, my body was rejecting the chemotherapy. My organs started showing signs of stress. My liver function became critically impaired. Blood tests came back worse every time. The doctors held an emergency meeting to discuss whether continuing treatment was causing more harm than the cancer itself. Dr. Patel sat my parents down in a conference room. I was there too, in my wheelchair, feeling like I'd aged 40 years. The chemotherapy is destroying his organs faster than it's fighting the cancer, Dr. Patel said bluntly. His liver is borderline failing. His kidneys are showing significant damage. We need to stop immediately. But the cancer, my mom started, will continue growing, yes. But if we don't stop the chemo, his organs will fail completely. At which point the cancer becomes irrelevant because his body will shut down anyway. So what do we do? My dad asked. We try a different approach. Targeted radiation. It's less systemic, focuses specifically on the tumor sites. But his body is so weak right now that we need to wait for him to stabilize before we can start. How long? I asked. My voice came out raspy. 2 weeks minimum, maybe 3. We need your liver function to improve and your blood counts to come back up. And during that time, the cancer just grows. Yes, they stopped the chemo that day. For 2 weeks, I just sat there in my hospital room, getting weaker, knowing the cancer was spreading. Maya was released from the hospital as an outpatient around this time. The trial was working so well, they felt comfortable letting her continue treatment at home. But she refused to go home. I'm not leaving, she told our parents flat out. I'll stay in a hotel near the hospital. I need to be close to him. Maya, you need rest. You need to be in a comfortable place. I'll rest in a hotel room, but I'm not going back to that house while he's still here. My mom tried to argue, but Maya wouldn't budge. So my mom moved into a hotel with her. The Holiday Inn 2 blocks away, apparently. They got a room with 2 beds. My dad stayed at the hospital with me overnight, sleeping in the chair next to my bed or sometimes just in his car in the parking lot like he'd been doing. Our family was now split across 3 locations: hotel, hospital, and parking lot. We communicated mostly through text messages and brief phone calls. I saw Maya every day, though. She'd walk over from the hotel every morning and spend hours in my room. Sometimes we'd talk. Sometimes we'd just watch movies on my laptop. Sometimes she'd fall asleep in the chair and I'd just watch her breathe, grateful she was still alive. The targeted radiation began after 2 weeks of waiting. They said my liver function had improved enough to try. The radiation was extremely painful. They had to position me in specific ways that aggravated my hip injury. The treatment itself felt like being burned from the inside out. My skin started developing burns where the radiation was focused, angry red patches that blistered and wept. Breathing became difficult because one of the tumor sites was near my lungs. Then I developed pneumonia as a complication. My already damaged lungs couldn't handle the stress of the radiation and the cancer. They put me on oxygen support, a tube in my nose feeding me air. Every breath felt like inhaling glass. During my pneumonia treatment, Maya's cancer suddenly returned with a vengeance. The immunotherapy that had been working just stopped, like the cancer had figured out a workaround. Her tumors grew back faster than before, in a matter of days, not weeks, and they spread to her spine. Dr. Chen called an emergency meeting. Maya was back in the hospital, in a room 5 doors down from mine. The cancer has adapted to the immunotherapy, he explained. It's learned how to evade the treatment. This is unfortunately common with experimental therapies. The body, or the cancer, eventually finds a way around it. So we try something else, my mom said. We will, but the spinal involvement is concerning. We need to address that immediately or she'll lose mobility. Within days of that conversation, we were both back in the ICU. Maya in room 412, me in room 417. My parents shuttled between rooms every 30 minutes. They'd stay with me for a bit, check on Maya, come back to me, check on Maya. Neither of them slept. They just walked back and forth like zombies. I could hear Maya screaming sometimes, when they moved her for scans, when they adjusted her position, when the pain medication wore off. The sound of her screaming was worse than any physical pain I was experiencing. The tumors pressing on her spine were causing paralysis from the waist down. We're doing everything we can to reduce the pressure, Dr. Chen said. But even if we shrink the tumors, the damage to the nerves might be permanent. She was 15 years old and paralyzed. Couldn't feel her legs at all. I heard her one night screaming at a nurse, "Just let me die. Please, just let me die. I can't do this anymore." My heart broke into pieces. My radiation treatment showed minimal results. The tumors in my lymph nodes had not responded to the targeted approach. New ones had appeared in my lungs despite the treatment. Dr. Patel came to my room with that look. The one doctors get when they're about to deliver really bad news. "We're running out of options," he said quietly. "The cancer is aggressive, and it's not responding to any of our treatments. I think we need to discuss palliative care." "No, I understand that's not what you want to hear. My sister is still fighting. I'm not giving up. Your body might not survive another round of treatment. The damage to your organs is severe. Another protocol could kill you faster than the cancer will. Then it kills me. But I'm not stopping while she's still trying." He looked at me for a long moment, then nodded. "Okay, I'll see what we can put together." They started me on a last resort combination of experimental drugs that weren't typically used together. The side effects were brutal. I hallucinated for 3 days straight. In the hallucinations, I was back at the beach with Maya. She was 6 years old again, holding my hand, screaming and laughing as we walked into the water. Every time a wave came, she'd grip tighter, over and over. The same memory on loop. When I finally came out of it, Maya was sitting in the chair next to my bed. She looked terrible, thin and pale and exhausted. "You kept saying my name," she said. "In your sleep or whatever. You kept saying, 'Hold on.'" "Sorry. Don't be sorry." She reached over and took my hand, squeezed it 3 times. I squeezed back 3 times. Her pain became unmanageable even with maximum morphine doses. I could hear her through the wall, begging for relief. "Please," she'd cry. "Please make it stop." The doctors increased her medication as much as they safely could, but there's only so much they can do when the pain is that severe. She told a nurse one night, when she didn't know I was awake in the next room, "I'm only staying alive because I can't let him be alone. I can't die first." The nurse murmured something comforting. Maya just cried. I lay in my bed, listening through the wall, feeling my heart shatter all over again. My experimental drug combination caused my kidneys to fail. They put me on emergency dialysis. My body was shutting down system by system. The doctors gave me less than a week without a miracle. My parents were called in for another meeting, the final one probably. Dr. Patel was direct. "His organs are failing. The dialysis is buying time, but not much. Days at most. We need to discuss stopping treatment and making him comfortable." My dad's face was completely blank, like he'd run out of ways to react to bad news. My mom just nodded. "What about Maya?" "Doctor," Chen stepped in. "We need to have a similar conversation about her. The spinal tumors are continuing to grow despite radiation. She's in constant pain that we can't adequately control. Her quality of life is essentially non-existent at this point. So you're saying we should let them both die?" my dad said flatly. "I'm saying we should stop causing them additional suffering. Let them be comfortable. Let them have peace." There was a long silence. Finally, my mom spoke. Her voice was hollow. "I need time to think about it." "Of course. But please don't wait too long. Every day we continue this treatment is another day they're suffering." My dad left the meeting and I heard him punching the wall in the hallway, over and over until someone stopped him. On a Tuesday morning, my mother finally agreed to stop Maya's treatment. I was barely conscious at this point, fading in and out, but I heard my mom's voice through the wall. "Okay," she said, just that one word. They moved Maya to a palliative care room with a window, a real window that overlooked trees and the parking lot and the sky. She asked to see me one last time. Nurses wheeled my bed into her room despite hospital protocol. They knew. Everyone knew. We lay in our hospital beds side by side for 6 hours, too weak to talk much, just holding hands across the gap between the beds. "I'm not scared anymore," Maya said at some point. Her voice was barely a whisper. I squeezed her hand. 3 times. She squeezed back. 3 times. Then twice more. 5 total. 5 squeezes was a new signal. We'd never used it before, but somehow I understood what it meant. "Thank you." I watched her, memorized her face, the shape of her eyes, the exact shade of what little remained of her eyebrows, the small scar on her chin from when she fell off her bike at 8 years old. She was looking at me too, really looking, like she was doing the same thing. "Beach," she whispered. "Beach," I agreed. I thought about that day, her hand in mine, the waves, her screaming and laughing, how tight she held on. At 7:34 p.m., Maya's heart monitor went flat. She was looking at me when it happened. She smiled, actually smiled. Then she was gone. The nurses came in immediately, but there was nothing to do. They'd already stopped all interventions. My mom's scream echoed through the entire floor, a sound I'll never forget if I live 1,000 years. My dad just stood there, staring at Maya's body, not moving, not making any sound at all. I lay in my bed next to her, still holding her hand even though it was starting to go cold, feeling my own body shutting down. After Maya died, I stopped responding to treatment entirely. My body just gave up, like it had been waiting for permission. My organs began failing one after another over the next 2 days. Kidneys, liver, lungs. The machines were the only thing keeping me alive at this point. My parents made the decision to remove life support on Thursday afternoon. Dr. Patel brought the papers. My dad signed them with hands that shook so badly he could barely write his name. My mom held my hand, both her hands wrapped around mine. "It's okay," she said, crying. "It's okay to stop fighting now. Your sister is waiting for you." I wanted to tell her I loved her. Tell them both I loved them. Tell them thank you for everything. Tell them I was sorry, but I couldn't speak anymore. They disconnected the machines at 4:17 p.m. My heart continued beating on its own for 11 minutes.